Okay, so I have been taking a certification class on trauma center, trauma sensitive yoga because I think it's really important to be able to be more aware of our physical experience and how that connects to trauma and to emotions. So I'm going to be doing some of these reflections. We have to do a reflection every other week. So I'm going to do a couple of reflections and I want to do them on here because I think it's important to kind of get other people to think about some of these questions. So today's reflection is about the ACEs study. The ACEs stands for Adverse Childhood Experiences. So if you have had some adverse childhood experiences or experiences in childhood, you're more likely to carry those through into adulthood. So some of those things might be divorce or an illness in the family or a parent who's been incarcerated, things like that. So those are all part of ACEs. And so one of the things that we're finding is that a lot of individuals, like kids and adults, are diagnosed with some pretty heavy mental health diagnoses. And the trauma part has been, or like the adverse childhood experiences, that history has been kind of lacking. So, and I see that in my own practice when I've talked to people, they've not ever talked about some of the things that have happened. And so our question today is, how can diagnoses such as ADHD, autism, bipolar mask a trauma diagnosis or overlook? Like, why would we not look at trauma or assess that instead of going straight to the diagnosis? So my thoughts on this are that a lot of times we don't recognize some of those things as trauma, like worth talking about. So for example, if you had, let's just say you were a kid that had pneumonia and were hospitalized when you were 7 or 8. Now, like once you get done with it or once you recover and you're out on your own, people are like, well, you're fine, you recovered. But for that kid, that fear or that loneliness or that not understanding what was happening can be a trauma in and of itself. So we don't necessarily look at that stuff. Also, if you're in a family who has a lot of trauma, or the like the family system is not super healthy, you don't know that that's not healthy. You don't know that you don't know what you don't know. So you don't know that that isn't how it's supposed to be. And if physicians ask you, hey, is your family broken? You're going to say, no, it's fine. And same thing with like parents and caregivers. They're not necessarily going to go in. They might not recognize it. So they might not go in and say, oh, you might want to know this. These things might be important. So there can be a minimization of it. And also just as a society, we don't like to tell people, yes, I have trauma. That's just not something that we do. So we all want to be in this state of homeostasis and think that everything is good and we want to be good. So we don't necessarily talk about that stuff. So, but it's going to come out. It comes out no matter what. So that's where we start getting into this diagnoses. So when when they have something, if their body's holding on to something, it's going to come out. So it usually comes out in a behavior, which could be like anxiety. They could be avoiding certain things. They could be overreactive to certain things. For kids, it can come out like ADHD, like they can't focus or they're daydreaming. So sometimes it's easier to look at that and say, yes, this person has this problem, instead of really looking at the complex history that got to that point. So that's kind of my reflection on this, is that sometimes it's easier. Sometimes it's just lack of education or lack of awareness that there are all these things going on. It can be lack of awareness on the part of the caregiver and or the individual themselves. So there's just a lot of unknowns that are happening too. And then there's also just a fear. What if I do acknowledge some of these things? Then what? What does that mean? So a lot of times it can be easier to say, yes, I have ADHD, instead of, yeah, I grew up in a really dysfunctional or really unhealthy environment. That's my reflection on these readings and the the information that we have talked about, and especially on the ACEs study. Because an interesting thing, so a couple times this has happened where I've had siblings who grew up in the same home, same environment, same family, same parents, and their assessment of their ACEs was much different. Like one had, I don't know, I can't even remember for sure, but a very high number. The other one had a very low number because their perception also changes. And the older, or the one with the higher score, of course, that's part of the story that happens when they go to therapy. The one with lower numbers doesn't really think that there was anything wrong because they didn't experience the ACEs the same way, or experience the environment growing up, or didn't perceive it the same way as the other person. So that is also something that can happen too, is just kind of how you perceive it, what your perception is, what other people's perceptions are. If things are really broken and unhealthy, but everyone else seems to think it's fine, then you might be likely to think it's fine. So that is it. Just reflecting on being more conscious of trauma sensitivity and how perceptions might change, how lack of education or lack of awareness might change things, and just trying to advocate for doing better.